Hello everyone. In this video, I'll discuss a disease that is caused by one of the Spirochetes members, which is syphilis that is caused by Treponema pallidum. Spirochetes are gram-negative bacteria. They are long, thin, spiral-shaped or called corkscrew-shaped. They have endoflagella or called axial filaments, which enable them to penetrate the host tissues. And they contain distinctive diderm, which means they have double membrane. Since spirochetes are very thin rods or bacilli, they are poorly stained by the Gram stain. This is why spirochetes are only seen by dark field microscopy or immunofluorescence or silver impregnation. There are many pathogenic members of spirochetes like the Treponema pallidum, which we will discuss in this video. It causes syphilis. And we also have Borrelia species like the Borrelia recurrentis, which causes relapsing fever, and Borrelia burgdorferi, which causes Lyme disease. We also have Leptospira interrogans, which causes leptospirosis. Syphilis is a human infection caused by Treponema pallidum. It's most commonly known as a sexually transmitted disease, but it has other ways of transmission. Treponema pallidum is an obligate parasite, meaning it's an intracellular bacteria that grows slowly in host tissues. It cannot be grown in any bacteriologic media or cell culture because it needs complex nutritional requirements of carbon and glucose to grow, and it also has high sensitivity to environmental factors. Syphilis can be transmitted by three ways. The first and the most common way is acquired, which is why syphilis is known as a sexually transmitted disease. It's transmitted from the infectious lesions of the skin or mucous membranes of the genitalia and mouth to the other person by intimate contact. The person who acquires syphilis goes through 4 stages, which will be discussed later on in this video. The second way is congenital, which means it's transmitted transplacentally from pregnant women to their fetuses. Babies who are born with congenital syphilis have characteristic teeth and nose. The last way is the blood transfusion, which means it's transmitted by a contaminated syringe, and it commonly happens during the early stage of syphilis. Acquired syphilis has 4 stages. The first stage is called primary stage. This is the most infectious stage of the disease. Spirochetes multiply at the site of the inoculation, causing a local hard painless ulcer called a chancre. This chancre or lesion appears on genital organs or lips or any part of the skin. This commonly happens after an asymptomatic period of 10 to 90 days. The ulcer heals spontaneously, however it's highly infectious, and spirochetes may widely spread to many organs through bloodstream. The secondary stage happens after 1 to 3 months of asymptomatic period. Lesions may appear as a red maculopapular rash on the palm and soles of the patient. If papules on the skin and mucous membranes later ulcerate on the genitals, they are called condyloma lata. These lesions are rich in spirochetes and are highly infectious, but they also heal spontaneously. If they are not treated early, the disease progresses to the latent and possibly to the tertiary stage. In the latent hidden stage, patients show no visible sign or symptom of syphilis, and they are divided into 2 groups. Patients with early latent period, which means they had the infection within the last 12 months, or late latent period, which means they acquired the infection more than 12 months ago. Tertiary stage happens after 1 to 10 years of infection. In this stage, granulomatous lesions or nodules called gammas appear on the skin and bones. Lesions result from hypersensitivity reactions and can be extremely disfiguring. This stage may be fatal due to the CNS involvement and the brain or cardiovascular damage. This is why this stage can be called neurosyphilis. In the tertiary lesions, treponemas are rarely seen. So to conclude the 4 stages of acquired syphilis, the primary stage happens after 90 days of infection. It's known by the infectious sores or the chancres that appear on genitalia and the mouth. The secondary stage happens after 1 to 3 months of the primary stage, and it's known by the skin rash that appears on the palm and soles of the patient. In the latent stage, symptoms disappear, and this can be early, within the 12 months of infection, or latent stage, which means after 12 months of infection. In the tertiary stage, serious health problems happen due to the involvement of the cardiovascular system and the CNS. Transplacental spread of Treponema pallidum after the 3rd month of pregnancy may result in fetal death or prematurity, or infected infants who survive but develop a condition similar to secondary syphilis. It also causes enlargement of the liver, spleen, lymph nodes, and brain damage, and also bone lesions can occur. Congenital syphilis leaves residual characteristic signs like the Hutchinson's teeth and saddle nose. As for the immune response to syphilis, antibodies are produced to the organism, but they do not stop the progression of the disease. Patients with early syphilis who have been treated can contract syphilis again, and patients with late syphilis are relatively resistant to reinfection. For the prevention and control of syphilis, early diagnosis and adequate treatment are widely advised. Condoms should be used during the sexual intercourse. Serologic follow-up should be done to the infected individuals and their contacts. Sadly, there is no vaccine against syphilis because the outer membrane of Treponema pallidum has too few surface proteins for an antibody to be effective. The most effective treatment of all stages of syphilis is penicillin. Penicillin is given as benzathine penicillin or penicillin G. Benzathine penicillin is used because it's absorbed slowly from this intramuscular depot preparation, and bactericidal concentrations are present in the body for weeks after administration of the antibiotic. No resistance to penicillin has been observed, which makes it even more perfect for the treatment of syphilis. For patients allergic to penicillin, tetracycline or erythromycin can be used, but must be given for prolonged periods.